It's a pleasure to speak today. Thank you for inviting me. I've very much enjoyed the previous 2 days. So in today's presentation, I'll give you some insights from my body of research on conflicts of interest. I'll focus on some of the psychological processes involved when dealing with such conflicts. And the studies I've conducted over many years are not all exclusively focused on research funding, but on conflicts of interest more broadly. But they are informative about the effects of such conflicts on our behavior, and we can draw implications about how to manage such conflicts to ensure independence and good quality health research. Now, I strongly believe that our reactions to conflicts of interest and the policies intended to mitigate them cannot be fully understood without a thorough consideration of our psychological experience of them. So as an organizational psychologist, I will focus on that. So first of all, I have no conflicts of interest to declare with respect to these studies, and I am employed by Cornell University. So there's been a number of policy solutions for dealing with conflicts of interest that have been proposed, such as fines and sanctions, education, second opinions, and disclosure. And I've written about these in detail in the paper cited and concluded that these solutions, unfortunately, are largely based on inaccurate intuitions regarding the psychological processes that underlie them. And so often they tend to fail or have unintended consequences. This morning, I'm going to focus on two potential solutions: disclosing conflicts of interest and cultivating professionalism. So let's start with disclosure, which I've studied extensively. A couple of people have mentioned it in the previous days, but I want to take a deeper look at some of the psychological effects of disclosure on both recipients and those who disclose to see where it hurts and where it could possibly help. So I've conducted over 50 studies in this area with over 15,000 participants. And although a couple of people have mentioned and noted in the earlier days that disclosure is not a solution for conflicts of interest, it is actually across a range of industries and sectors the most commonly proposed and implemented solution for dealing with conflicts of interest. Often it's the only solution that people use for managing conflicts of interest. So why is it so popular? It's popular for recipients as we think we might use the information to make an informed choice. So perhaps having been alerted to some potential bias, we might want to discount the conclusions or recommendations or advice we receive. And some people really love this because it appeals to our principles for transparency and free markets. However, disclosure itself doesn't work too well when I test it. And an important note about my studies is that I make the disclosures very simple, timely, and very clear and easy to understand. But even then, I find that people often don't know what to do with the disclosure, so they end up ignoring it, or they discount insufficiently or erratically. There's just this large variance, which makes sense because to really discount accurately, you have to have a mental model of how the conflict of interest has biased the recommendation and then discount for exactly that amount. And other people have found that with regards to research studies, physicians reading papers that either have industry disclosures or not are less willing to prescribe certain drugs if they come with a conflict of interest disclosure. And that's regardless of the scientific rigor. Although, again, as noticed by several people earlier in the earlier days, bias doesn't often show up when assessing scientific rigor from a published paper, but in other places in the research process. So that decreased confidence could arguably be an appropriate response to conflict of interest disclosure. I've also found that when we can actually see everything going on behind the scenes, and we're fully confident about the high quality of advice that we may be given, there's still a disclosure penalty, what I call a disclosure penalty, even with the best possible recommendations. And then there's some other extremely problematic unintended consequences. So, for example, I've documented this effect that I call disclosure's expertise cue. And this is in certain situations when you have a high cognitive load, which most of us have, we're busy, there's lots of information, we process disclosures automatically or peripherally. We don't deliberate and focus on what it actually means. And in those situations, disclosure becomes a cue to the provider's expertise. And in other situations, even if you have decreased trust, arguably the correct response to conflicts of interest, I've also documented this increased compliance for a number of different reasons. One of the main ones being that an unwillingness to signal distrust to those that are disclosing. So from all these things, you can see that disclosure doesn't work too well on recipients, but what about the effect on those who actually accept the conflicts of interest? Now, often, even though people might dislike disclosure, it could be attractive in certain ways to other possibilities because nothing needs to change. You can carry on doing what you're doing, but simply disclose. And it could relieve advisors of any guilt or negative feelings for any unfavorable outcomes that occur. And of course, it limits professional liability. But I've also found that it changes the behavior in a couple of other ways. So here's one positive aspect, is that disclosure could actually lead people to reject conflicts of interest so that they can disclose the absence of any conflicts of interest. So people are motivated to appear unbiased, and disclosure works best, not when it depends on consumers responding effectively, but rather on when it influences the behavior of the people whom the disclosure is about, encouraging them to improve and reject conflicts of interest. So it's reputational concerns or an aversion to being viewed as corrupt that could be drivers of this effect. And we've seen this in other industries. So mandatory disclosure of automobile rollover ratings was successful in leading car manufacturers to improve their designs to obtain better ratings. And the same thing happened to a certain extent with health rating grades in restaurants. But for this to happen, it's more likely to occur when people know at the same time as they are accepting the conflict of interest, they have to disclose it in a very simple, easy to understand way that is visible and salient. It also has to be possible to reject conflicts of interest. And most of the time, there is this temporal gap between accepting and disclosing. And the conflicts of interest might not even be that visible to people, even if it is reported somewhere in a research paper. What happens in these types of situations when you've already accepted a conflict of interest? Well, older research has suggested that disclosure might increase bias in advisors. But in several studies, I actually find that story is not quite complete. So the prior research was conducted in a student lab with non-expert participants, but when you actually go to the field and look at the actual behavior of physicians and other professionals, we see different things occurring. So in studies I conducted with actual professionals, so physicians, what's really important to look at is the professional norms. And what we see with physicians or medical advisors, we think they have a professional norm of patients first, and physicians also think that, right? That do no harm, patients have to come first. With financial advisors, often the lay public think that they're very self-interested, but at least a certain group of them do have a fiduciary duty to put their clients first. And in 2016, there was an executive order from the White House requiring retirement investment advisors to place clients first, savers' interests first. Unfortunately, that was overturned with the change in government, so we can't explore whether that would made a difference. But we do need to know if conflict of interest disclosure changes the behavior of those who disclose, what is happening and in what way is it happening. And across a number of different studies, what I found is that disclosure's effect on providers really depends on the salience of the professional norms and what those norms actually are. So, for example, in a financial context, if there is a self-interest first norm, and a lot of lay people think that there is, I do see this increase in bias with conflict of interest disclosure. It can change and lower the quality of advice. In the medical context, which is often a patient's first norm, I do see a decrease in bias with conflict of interest disclosure. So the effect of disclosure, the sign can change radically. And in situations where we see such drastic sign changes, it often is about the context. There's something different about the context. And here it is the professional norms. What do people think is the right thing to do? What do I do as a person in this situation? So disclosure can improve the quality of advice, but only if the norm is to place clients first, patients first, readers first, the public first. It acts as a reminder to do the right thing. And so these social or professional norms are extremely powerful. If it is not acceptable to give self-interested advice, conflict of interest disclosure will improve the behavior. If it is acceptable to give self-interested advice, it works as a reminder and it does lower the advice quality. And what's interesting, it's not disclosure that's the key element, it's the reminder. So just reminding people that you have a conflict of interest works in the same way as the conflict of interest disclosure. It's the professional norm that changes the behavior. So there's evidence here that disclosure can have unintended effects on advisors. If there's a self-interest norm, you will see this increased bias, but it also is a signal that reminds advisors to place others first and lead them to rein in the bias in their advice. So it's not just about transparency, it's about transparency and the professional norms, which are often quite hard to capture, and they do change a lot. So our biggest psychological process to overcome actually is our amazing ability to rationalize. And as I conclude in this paper, that often once we've disclosed, we think we've dealt with our moral obligations with respect to conflict of interest. And this rationalization can actually crowd out more effective solutions for managing conflicts of interest. So there could even be an indirect harm of disclosure. And although I've just shown that my studies might have a positive effect on decreasing bias in advice when the norm is to place others first, the effect size of that is much smaller than simply rejecting the conflict of interest. So it's not a great solution. I don't recommend it as the solution to managing conflicts of interest, unless it leads people to reject conflicts of interest themselves and improve the quality. And as others have said, disclosure is insufficient. It does not manage the conflict of interest, but merely identifies the existence of such conflicts so we can consider how to manage them. And disclosure itself can also lead to a number of unintended consequences for recipients, as I've described. So what else can we do? What else can we do in addition to disclosure? So I've identified that professional norms might be useful. So let's examine that a little bit more. They're important, but what do we actually mean by professionalism? Originally, professionalism was conceived as a feature of traditional professions such as medicine and law that's organized like guilds with codified training and high barriers to entry. But the concept of professionalism has now evolved into one that is a general concept describing how one conducts oneself, right? So in the words of one pair of scholars, professionalism is a set of values and identities that can be mobilized by employers as a form of self-discipline. And many scholars state that a belief in self-regulation is a key aspect of professionalism and the ability to actively manage the conflict between the client and personal interests to favor the client. So if professionalism is now a self-concept, can we improve people's character? Can we improve their integrity and their professionalism? And will that lead them to reject conflicts of interest? or could it make matters worse? It's an important question because of how we think about ourselves. We often think that we're immune to unwanted influence, and physicians say they are not influenced by industry incentives. As this quote shows, I would not let an industry representative influence me to do anything that would not be in the best interests of my patients. I can manage my own brain. Although physicians might admit that other physicians are likely to be influenced, they don't think that they themselves are. And this often self-serving justification leads to a lack of ability to predict influence. And that's why we see physicians and other professionals taking this great offense at the notion that they could possibly be influenced by financial incentives. They claim to be a professional, and because of that, because they are professionals, they will not be influenced. And that reaction again reveals the wrong mental model of conflicts of interest, that influence is within our conscious control. And although a strong sense of professionalism might help defend against intentional corruption, it does not mitigate against unintentional or implicit bias that arises from conflicts of interest. So how might a sense of professionalism, if you want to think about the ability to remain impartial and make independent decisions that transcend self-interest, affect researchers and physicians? Well, in my work, I've found that a high self-concept of professionalism often coexists with a shallow notion of the concept, and it can paradoxically lead to detrimental outcomes such as increased unethical behavior and increased vulnerability to conflicts of interest. So a strong sense of professionalism can actually make matters worse. How does it do that? Well, first of all, those with a strong but shallow sense of professionalism might be more likely to accept conflicts of interest because of their high confidence in their ability to consciously control for any biasing influence. So we've seen this in the domain of overeating and smoking, that if we have a strong belief in our own ability to regulate, we won't remove the high-calorie foods from our house or a cigarette packet from our pocket. So we're more likely to lapse and eat more and smoke more than we want. And in the same way, those with a high sense of professionalism might be more willing to accept conflicts of interest precisely because they feel they won't be influenced by them. And second, once a conflict of interest has been received, a high sense of professionalism may reassure physicians that they're capable of warding off influence. And so they actually work less hard than others to correct for a potential bias, ironically, again, leading to both the greater acceptance of conflicts of interest and more bias. So there could be this double harm that can arise from professionalism, in that it makes people more vulnerable to view conflicts of interest as acceptable and succumb to the bias from conflicts of interest. And people remain unaware of that bias. They can't predict it in advance, and they can't recognize it in hindsight. So what's needed is what I call deep professionalism rather than shallow professionalism. Shallow professionals fail to understand the risks of undue influence, and they rely on their own subjective feelings of their ability to self-regulate, which can be wholly inaccurate. Deep professionals, however, recognize the risks and they avoid exposing themselves to conflicts of interest in the first place. So they embrace this continued ethical training to help embed principles, and they display deep professionalism with repeated ethical behaviors. So, for example, if a hospital policy bans pharmaceutical representatives from interacting with physicians in their hospitals and stops the free lunches, physicians who understand the deeper concept of professionalism will also reject walking across the street from the hospital to indulge in the free lunches that the company now sets up in the hotel conference rooms. So even if a policy does not regulate physicians' behavior outside of the hospital, those with deep professionalism will understand and internalize the principles and values of self-regulation as well as nurture the values repeatedly with an active practice. So we need to integrate both approaches. We need clear policies and procedures in place to eliminate or at least mitigate conflicts of interest, and we need to cultivate deep professionalism. So the best policy would be to reject conflicts of interest, so have unconflicted research. Another one, when that's not possible, is to implement separation and blinding policies. So, for example, institutions could allow the receipt of funding, provided that researchers are separated from decisions involving the funding source and they do not meet the people involved. They need to be blind to their identities. And this separation and blinding needs to be implanted before specific situations arrive to avoid distortions. Now, at a meeting I went to several years ago, where we were talking about separation and blinding, one orthopedic surgeon approached me afterwards to describe that's what they attempt to do in his institution. They have a central fund for research where industry can contribute, and then they can apply surgeons can apply, physicians can apply within the institution for research funding. But the problem came was once they received it, they revealed the source behind the funding, and these surgeons then had to write a thank you letter, which basically degrades the blindness and the independence of the research. So it does need to be implemented well. And along with open data, pre-registration, submitting registered reports, and what I put here is simple star or grade ratings. So they're really easy to understand by other people rather than in addition to the disclosures. So you could have a grade A if unconflicted. Those things could lead to a self-calibrating effect where people are motivated to do better to get higher ratings, and institutions, people may want to give better quality research. But we do need to be careful with stars and grades that people don't start to game the system to get a high rating if they don't deserve it. That's why we also need to teach the concept and importance of deep professionalism in all institutions, medical schools, medical organizations, and other research institutions, and select positive role models into institutions that demonstrate and model deep professionalism. So physicians, researchers who are high in humility, and importantly, they understand the limits of their own ability to regulate bias. So integrating these two approaches together, I believe, is the best approach to managing conflicts of interest. Thank you very much.
Thank you. That was wonderful. While we wait to see if any clarifying questions come in, I have a quick question for you. I've done a lot of work with early career professionals, researchers in particular, and one of the things that I have encountered recently is a generational concern about the concept of professionalism, that somehow professionalism is limiting and imposing old style views. Do you encounter generational reactions to the concept of professionalism?
I mean, the definition can change, right? So it depends on what you mean by professionalism. And if we're looking at competence, quality, integrity, and self-regulation, I wouldn't see how people might oppose that. If it's about the style in terms of what clothes you are wearing and other aspects of formality, which is not how I define professionalism, I can see how a younger generation might object to that.
And so how do we convey the deep meaning that you are, which is entirely congruent with the kinds of what I think of as professionalism, without also trying to impose the senses of formality and...
So to me, I would describe sort of what you wear on a day-to-day basis very differently from professionalism, which is what I propose is that we need to get away from professionalism as being a character trait, but more as a set of repeated behaviors that demonstrate ethical behavior. That's what I would like to to teach this concept of what we mean by deep professionalism. And once people understand what it means, I think these objections will be mitigated. Thank you.
I think that's very helpful, because I think that goes to the heart of where the objections are arising and how we need to shape our messaging to communicate more effectively in a time when generational differences are very real in perception and conduct.
Thank you.
Are there any other questions for Dr. Sah before we go on? We are a little bit ahead of schedule, so there is room if any of the panel members or our committee members who are here had any questions.
No, go. I see Lisa's hand up. Go
Dr.
ahead.
Barrow has a question.
Sorry,
Lisa.
I can always come up with a question, but that was a fabulous talk. Thank you so much. And I was really interested in your management strategy around pooling funding. And the story you told of the surgeon was very interesting about how hard it is to put that in practice. And I've been at 2 institutions where we have managed to put that kind of pooling mechanism in practice. And what happened was that companies just pulled out their funding because they realized they could no longer have any influence, presumably. So I was just wondering, have you heard any anecdotes about that, or is there any evidence on that?
It's possible, right? If the criteria is to influence the research, and that there might be some backlash, right? If it is truly separated and blinded and results are going to be published, then that could appear as a threat to certain institutions. But if it becomes that this is how we will, this is the only way that we will accept research funding if you want funding in this area, it's possible that they could start disclosing how much they pay towards research and independent research as being a positive aspect. And if they're motivated to do that, and more people start doing it, it becomes the norm, right? That we've contributed X amount to research in these particular areas, and this is the way, this is the new norm of how we allocate research funds.
Thank you.
Dr. Woodruff.
Hi, yeah, that was a really interesting talk. When you were answering the question about professionalism, I was wondering if you've given any thought to not calling it professional, but calling it, ethics or more ethical response, or you use some other language. You know what I'm saying? Like maybe professionalism it's too hard to change the language.
It's perhaps. What's interesting is that people will use that language to claim that they have integrity and character, right? So this is where my research stemmed from, is hearing lots of people like executives of accounting firms claiming that they don't need any regulation because of the people that they employ and the character of those people, that they're high in professionalism. And yet those statements were done just before the collapse of Enron. And so if people are using this as a justification for how they can self-regulate and manage their bias, I think it's important to address full on. Like, if you think you're a professional, you think you're actually immune to bias, and that can actually make things worse. So yes, we can call it deep professionalism to really distinguish between the two, because I don't think the word is going to disappear completely. And it is an important word to some extent. It just depends on whether we teach the concept of deep professionalism and what it actually means. One of the key aspects is having some humility and recognizing that we are influenced in ways that we don't intend to or want to be.